Everyone, I'm Debbie Leone, and I am the Information Services Coordinator for the Epilepsy Foundation of Minnesota. On behalf of EFMN, I'd like to thank you all for joining us for our Wellness Wednesday webinar. Today's webinar is entitled Seizure Smart School Legislation Supporting Children with Epilepsy. In addition to our webinars, EFMN does offer a range of programs and services that provide support, connection, and education to those who are impacted by epilepsy. Many of you may be familiar with our camp programs that we hold in the summertime, which include Camp Oz, our one-week overnight traditional camp program, our day camp for youth, younger youth who to help them get prepared for attending overnight camp, and family camp for those with additional physical, social, or emotional needs. Our virtual Connect groups are a place where they meet on a monthly basis, and it's a space where individuals impacted by epilepsy can meet others with a similar epilepsy journey, and they can share their experiences and peer support. We offer Connect groups for a number of audiences: adults with epilepsy, parents and caregivers of children with epilepsy, young adults, teens, those with a rare or complex diagnosis. We also have a quarterly Connect group for those who have lost a loved one to epilepsy. And we also offer occasional customized Connect groups for specific audiences as the need arises. Education Services offers Seizure Smart trainings for schools, workplaces, social service organizations, healthcare facilities, and more, as well as our live webinars. Our information services provide individuals, caregivers, and professionals information and resources on a wide variety of epilepsy-related topics through free one-to-one customized support. Our Shining Star program is for all youth with epilepsy under the age of 18. And it includes connection opportunities for youth, support services or support resources for families, and epilepsy awareness opportunities for families and communities. We know that epilepsy can feel isolating, so our social events seek to bring together all types of people affected by epilepsy to connect, to share experiences, and to have some fun. These events happen throughout the year and vary by region of the state to meet local needs. Our advocacy efforts aim to shape public policy at the local and state levels with the goal of making Minnesota a better place for those living with epilepsy. And you'll learn more about our advocacy program in this webinar. And finally, our donated goods operation plays a key role in serving the epilepsy community in Minnesota. Donations of clothing and household items help us to fund our programs and services. And information about where we offer free pickup or drop-off bins is available on the EFMN website. We have a number of great events happening in the month of October. I mentioned our Connect groups. Our young adults will meet on the 6th, our teens on October 11th. One of those customized groups will be meeting on October 11th, and that is for folks with epilepsy who also happen to be parents. Our Rare Epilepsies group will meet on the 18th, parents and caregivers on the 20th, Spanish speakers on the 26th. That's another one of the customized groups, and adults with epilepsy on the 27th. We're also really excited about our annual Mall of America Shining Star event, which will be held on Saturday, October 15th. Our Shining Stars will get together at the Mall of America, and there will be a program, and they will be able to get wristbands and ride the rides. It's always something that our kids look forward to every year. And finally, under our social events, we have a season of giving events focusing on crafts and card making, and those will be held in Bemidji and St. Cloud on October 27th. And if you'd like more information and details on those or to register, you can go to epilepsyfoundationmn.org/events to see our events calendar. A few housekeeping items before we get started tonight. This will be an hour and 15-minute long webinar. And in order to have the best webinar experience, we do encourage you to close out any windows that might be using a lot of bandwidth, particularly things like music applications or streaming services. We will provide you with a certificate of attendance that will be sent to you within 3 business days in a follow-up email. And I will also send a copy of this PowerPoint presentation. So if you're worried about taking notes, you will get a copy of this emailed to you so you can refer back to them. The webinar is being recorded, and a link to request that recording will be posted on the EFMN website for future viewing. You will notice that we have closed captioning activated. If you don't wish to see the captions, click on the CC icon at the bottom of your screen where you can choose to hide the subtitles. We do encourage you to ask questions during the webinar by clicking on the Q&A icon at the bottom of your screen. That will bring up a box where you can type in your question and then hit send. And we are going to hold those questions. However, there will be 2 opportunities to have questions answered. We have 2 different speakers, and we will do a short Q&A session at the end of each of the speakers' presentations tonight. So you can type your questions in whenever you want, and we'll get to as many of them as we possibly can during the 2 Q&A sessions. Please, to respect everyone's privacy, keep your questions as general as possible and not specific to any one child's epilepsy or school experience. You can also use that Q&A box to let us know if you're having any kind of technical problems. My colleague, Kenzie Mabron, is here with us off camera, and she will be helping with those types of issues. So you can type those kinds of technical questions into the Q&A box as well. And to avoid any kind of confusion, the chat feature for attendees has been disabled. Our objectives for tonight are to recognize how advocacy helped ensure the passage of Minnesota's Seizure Smart Schools and other legislation that affects people with epilepsy, to identify the components of the law, what it requires, and how it impacts students with epilepsy and seizures. Sorry about that. And to explore how EFMN programs and services support students with epilepsy in their families, both in and outside of the school setting. We have 2 presenters, as I mentioned, and I'm very excited to introduce you to them because they're both colleagues of mine. Sara Goodno is the Advocacy and Public Policy Manager for EFMN. She serves advocates throughout the state by helping to connect students with epilepsy to their elected officials. This session, she's lobbying for seizure detection devices to be covered under medical assistance, Minnesota Medicaid. And Sara received degrees in public policy and business at Bentley University. Nikki Baker, our second speaker, is our Healthcare Partnerships Director, and she began working with EFMN in 2003 as a regional manager. Throughout her 19 years with the organization, she's been critical in creating and refining many of the current program delivery models. In her current role, she creates strategic partnerships with regional healthcare systems and community organizations to provide coordinated, comprehensive, and culturally relevant care to people with epilepsy. Nikki earned her Bachelor of Science in School and Community Health from Winona State University and her master's degree in nonprofit management from Hamline University. She's trained as a certified health education specialist and an emergency medical technician. We are honored and excited to have Sara and Nikki here with us tonight, and I will now turn things over to Sara.
Hello, everyone, and thank you, Debbie, for that introduction. As Debbie mentioned, my name is Sara Goodno, and I'm the Advocacy and Public Policy Manager at the Epilepsy Foundation of Minnesota. And today I will be talking about the history of Seizure Smart Schools, the requirements under the Seizure Smart Schools law, and then talk a little bit more about best practices as well as other advocacy opportunities. To start out, I'd like to share a little bit of my personal background with Seizure Smart Schools. I have epilepsy myself. I've been seizure-free for 17 years and off meds for 15, but my second grade classroom was actually had a Seizure Smart Schools training back in the early 2000s when the program first started. With that being said, EFMN has been offering the Seizure Smart Schools program, which includes trainings to classrooms, to teachers, to school nurses, and other administrators since the early 2000s. But all of those trainings occurring would rely on key individuals, both at schools and parents of students with epilepsy. So we had trainings across the state. However, it wasn't every school. Schools reached out to us, and we went in to do the age appropriate trainings. With that being said, we wanted to expand our reach of Seizure Smart Schools. And a really good opportunity came up where one of our advocates, Ruth, who is pictured on the screen, she was in a college class and wrote a paper about how Seizure Smart Schools legislation would be really beneficial for students and would have been beneficial for her when she was in school. This actually corresponded with a nationwide advocacy opportunity that the National Epilepsy Foundation was pursuing called Seizure Smart or Seizure Safe Schools. So we were able to work with the National Foundation to clean up the language and get the bill introduced. The bill was initially introduced in 2019. We tried in 2019, it didn't go through yet. 2020, of course, the pandemic threw the legislature into a kerfuffle, but we were able to pass Seizure Smart Schools legislation in special session of 2021. And the legislation did go into effect this school year. So it is currently in effect and will be in effect for years moving forward. One other thing about the advocacy, it really shows that there are a number of different places where advocates can get involved in legislation. The first aspect is when a person has something that they're really passionate about, they can bring legislation forward. To us, we can help, but also to their legislator. That's one way to advocate. Advocates can also attend our Day at the Capitol, which is held in February, which is a time when a bunch of epilepsy advocates get together and speak to their legislators. And it's a really impactful event because there are so many conversations happening about epilepsy. And then a final way is the one-off advocate opportunities to speak with your legislator, which include most common ways of communicating. So email, phone, in-person meetings, and letters are all ways that you can communicate with your legislator and make a difference in advocacy. Next slide. So before I get into the specifics of the legislation, I wanted to go through a couple key phrases. Legislation can be very dense, and I just want to make sure that we're all on the same page with what words I'm using. So the first key phrase is Seizure Smart Schools. If you do a word search in the statute, you won't find Seizure Smart Schools written in it. It is actually, the official title is Seizure Training and Action Plan, and it is in the education statute, which is 121A.24. So that's the official title, but we are referring to that specific piece of legislation, that specific statute, as Seizure Smart Schools. Within that statute, a seizure action plan is an individualized health plan for students with seizure disorders. A designated individual is a person who would be other than the school nurse. So it's a school nurse or a designated individual who needs to be trained in seizure rescue medication administration, as well as seizure recognition and response. And then finally, seizure rescue medications are also known as emergency medications. And those are the medications that a person can take while they're having, while a seizure is occurring, to minimize the effects of those seizures. Next slide. So the law has 3 specific requirements. The first requirement is a seizure action plan. So a seizure action plan has to be in place for all students with a diagnosed seizure disorder and a prescribed rescue medication. And then there are 2 training aspects. One is for the nurse or the designated individual. And then the other is the training requirements for all staff. And we'll go into details in the following slides. Next, yep. So first, the seizure action plan. The seizure action plan is for, again, students with a diagnosed seizure disorder and a prescribed rescue medication. If a student does not technically have a prescribed rescue medication, they are not technically covered under the statute, but it is best practice for schools to have a seizure action plan in place for all students who experience seizures. In order to get the seizure action plan in place, parents must work with schools to implement those plans. So first, the parents or guardians will notify the school, and then we'll work together with the school nurse or other relevant parties to ensure that that seizure action plan is effective for their student and for the school. Next slide. The seizure action plan has two specific requirements that are laid out in statute. The first is the name of the school nurse or the designated individual who is trained in that rescue medication administration. The second aspect is the contact information of the designated individual. Oftentimes this will be a phone number, as it is the contact information that someone will use when a seizure is occurring. So like an email is not recommended because emails can get lost in mailboxes very easily. But a phone call, or if there's another communication system, that would be the most effective way, the most effective thing to put down in that space. And then on the next slide, we have the elements of a seizure action plan, the best practice elements. So as I mentioned, the name of the individual trained in the seizure rescue medication administration, the school nurse or the designated individual, their name should be on the seizure action plan. And the contact information should also be on that seizure action plan. But for best practices, there's a number of different things that are important to have on the seizure action plan. EFMN does have our own seizure action plan template, and I believe Nikki will be talking about it a little bit further when she presents. But this best practice information includes seizure types, what type of seizures the student has, what those seizures look like, the first aid for the student's type of seizures, as well as what general first aid is, what their rescue medication is, and what is the plan for administering that rescue medication, what the post-seizure care is for the student, seizure triggers, healthcare contacts, other relevant health information, and it should also include a communications plan. Next slide. The best practices for creating a seizure action plan. The number one most important thing is that families should work with schools, specifically the school nurse, if they're available, when developing a seizure action plan. This ensures that the school is well equipped to follow through on the action plan, and that the action plan is developed with a specific student in mind. As I mentioned on the last slide, it's very important that a communication plan is developed that includes when the parents or guardian will be notified in case of a seizure, as well as when emergency services should be called. Just because in a seizure event, you don't want to be, you want to know who needs to be contacted, and how to document what happened during the seizure event. It's also important in the seizure action plan to make sure you are specific on what seizure triggers the child might have, and to include all medications in that seizure action plan. Next slide. staff access to a student seizure action plan is one of the more complicated aspects that families and schools will need to think through in terms of this legislation. So first, the seizure action plan must be filed with the designated individual or the school nurse. That part's pretty easy, but all staff and volunteers responsible for the supervision or care of the student with a seizure disorder will receive notice and copy of the seizure action plan. That part can get a little bit more complicated because you have to think through the child's full day and determine who is responsible for supervision during all of those times. And those will be different depending on the type of school your student goes to. If they're in elementary school, middle school, high school, all of those aspects will be impactful. So for example, if your child is in elementary school and they have one specific teacher who teaches, say, English, math, science, and history, but they have a different teacher for their gym class and their art class. You would make sure that their one main teacher has the seizure action plan and knows how to respond, but you'd also pay attention to make sure that the gym teacher and the art teacher also have that seizure action plan and are able to respond to it. Another thing to keep in mind, especially for elementary schoolers, would be who is responsible for the supervision of students during, say, lunch and recess time. And if it's a consistent volunteer or if teachers rotate in their supervision, just making sure that there is someone there who has a seizure action plan and knows how to respond to your students' seizures. Of course, that experience will also be different in high school. If a student has 8 different teachers, those 8 teachers should have the seizure action plan. And if there are any extenuating circumstances where you're not sure if all of those teachers should have a seizure action plan or something like that, make sure to talk to your school and make sure that you come up with a plan that is most effective for you and the school is able to follow through on, to make sure that there is someone who is able to respond to the seizure. Going off of the seizure action plan and onto the training requirements, there are specific training requirements for the school nurse or the designated individual. According to statute, they must be trained in the recognition of signs and symptoms of seizures and appropriate steps to respond to seizures. Nikki, I believe, will also be talking about some of these trainings that we provide, but it is important to note that there are a number of different resources that can be found through EFMN or epilepsy.com that will teach school nurses that first aid seizure recognition and response aspect. School nurses or the designated individual also must be trained in the administration of anti-seizure medications. And there are a number of different trainings that EFMN can point to as good trainings, but you have to look for the rescue medication that is specific to the student or students that you have with epilepsy. And then the training requirements for all school staff working with students. The statute requires that all staff working with students have access to self-study materials on seizure disorder signs, symptoms, medications, and appropriate responses. Self-study materials includes a really wide range of trainings and materials. The best practice is still to do a training, whether that is a recorded training or a live training in person or online. But having that training is best practice, especially for staff and teachers who have students in their classroom with seizure disorders, or they have that seizure action plan. Best practice is to be as prepared as possible. However, at the very least, we have a self-study material packet that EFMN has put together and is on our website that includes information on all of those aspects. We have first aid for convulsive seizures, for partial seizures, general seizure recognition and response, the teacher's role, our medication guide, as well as EFMN information. So we recommend that as a minimum, but the best practice, again, would be to do a training. And there are a number of different lengths and different groups that these trainings are geared towards. So that was the end of the deep dive into the law. I'm going to just take a little bit to talk about EFMN advocacy and public policy a little bit more. So our advocacy focuses on connecting people impacted by epilepsy to their elected officials and increasing access to therapies through legislative and administrative action. In the past, we have 2 large pieces of legislation that we've passed. The first is a driving law, which was before my time, but we worked on legislation that would decrease the amount of time to 3 months after a seizure, where people would be able to get their licenses back, which increases people's ability to get around without increasing danger on the road, which is super important for our community. And then, of course, Seizure Smart Schools is a big piece of legislative change that gets seizure first aid into all of the public schools in Minnesota, which ensures that students with epilepsy are safe in their classrooms when they have a seizure, and will likely decrease the stigma around epilepsy because people will know how to respond. So those are the 2 big changes that we've made. And as Debbie mentioned at the beginning, we are working on legislation that will cover seizure detection devices under medical assistance, which is Minnesota Medicaid. Seizure detection devices are devices that will detect convulsive seizures and alert caregivers that a seizure is occurring, which decreases the risk of sudden unexpected death in epilepsy, or SUDEP. The only FDA approved device currently was approved in 2018. And unfortunately, law does not move as fast as technology. So we are working on getting the device and the subscription service covered. We got really close to passing it last year, and we will be working on it again this year. If you'd like to join us in sharing why seizure detection devices should be covered and advocating for the epilepsy community, we have a few events coming up. We have a next slide, Debbie. Sorry. We have a listening session on November 10th at 6:30, where we will talk about what we'll be pursuing in the next year and hearing from the community about what you guys would like us to look into for next year and the year after that, just to hear what are the policies that are impacting your lives. And then our other big event coming up, I say coming up, it's in about 6 months, but our Day at the Capitol, which is the end of February 22nd, where, as I mentioned before, we will have advocates will come together at the Capitol. Fingers crossed that we're in person this year. We've been virtual the past 2 years, but we will have a short morning program, and then we will move on and we will talk to our legislators during the day. And all the logistics are handled by EFMN, so you just have to show up and be ready to tell your story. We really hope to see people there. At this point, I think we will open it up for questions for me.
Hey, Sarah, it looks like we've got one question in the chat that says, who does the training for the school? Is it the parent or the guardian for that child?
So who does the training is the school. So we provide trainings. The teacher, like the parent or the guardian does not have to provide a training. They will help create the seizure action plan. But we have the trainings available through EFMN, and it's the responsibility of the school nurse and the administrators to ensure that everyone is adequately trained.
Kenzie, thank you for jumping in there. I was having some trouble getting my mic back on. Sorry about that. I'll go ahead, and looks like we might have a few more that have come in. Are student school plans similar or very different? I'm assuming they're talking about the seizure action plans there.
The seizure action plans. I'm not sure. Nikki or Debbie, do you?
I can take that one if you'd like. So we do recommend that the same type of information is entered into all of the seizure action plans. And so the various medications that a student may be on, the seizure triggers, how that seizure is presented or how it's displayed, like what your child their body presents with. So getting all that information in there is similar across seizure action plans. However, they can look very different as far as how each student needs to be responded to most appropriately. Some schools may have a more proactive approach on things. So it's not only what the a school is able to provide, but also what you request as a parent or a guardian, because you may want a specific protocol to be in a place that other parents may not need or want that a level of care. So they do tend to look at different as far as the actual type or the actual content in there, but the a type of information should be pretty consistent across the board.
Great, thank you, Nikki. Another question that came in, I'm not sure if we have an answer to this or not, but I'm assuming, Nikki, you might be the one to take this and I might be able to help a little bit. Are there more children with epilepsy since COVID-19?
So there has been actually a lot of research around, is there a link or a correlation between epilepsy and or seizure disorders and COVID-19? The answer to date is no, there is not a strong link between the two conditions. In fact, we have heard that since COVID, people were less likely to be seen by a physician. So that would in fact, I mean, like less people are actually getting diagnosed only because less people are seeking healthcare. That does not mean that the incidence of epilepsy has a decrease. So that is a really tricky thing to dig through, but all of the data to date says that there is not more children with epilepsy due to COVID.
Okay, thanks, Nikki. Another question here, on EFMN, I can find training to provide my teachers. What about further training for me as a school nurse?
And I will actually be talking about that in just a few minutes. And so if you can just hold tight for just a few slides and we will get to it exactly that, because we did really want to offer very specific training to the varying levels of school personnel. And so we'll get into how to access those.
And I think maybe, Nikki, this next question may also be something you're going to be answering later, asking about whether the trainings for school personnel are in person or remote. So maybe if you can just hang on to that question a little bit longer too, that's something that Nikki is going to also be covering. Sarah, a question for you. What can be done if a child's school is not complying with this law? Are there penalties in the law for this?
So there's currently not a specific penalty or compliance mechanism written into the law, but the Minnesota Department of Health is the one who is kind of in charge of the situation. I would recommend, if your school is having issues with the law, to talk to us, and we can help navigate that with your school and with MDH as well. I'll also note that policy is iterative. There is an implementation and what's it called? When you like track the policy and you see evaluation period, that's what it's called. My apologies. But if in the evaluation it's not as effective as we'd like it to be, we can go back to the legislature and ensure that make changes to ensure that it's working as best as it can.
Great. Does this law apply to charter schools as well as public schools?
Yes, it's public and charter schools. It does not apply to private schools. But you can always talk to your private school. So they wouldn't be required by law, but they can still do the same thing in line with the law.
Okay. You talked about having the requirement for every student with seizures to have a seizure action plan. What is does the school face any kind of liability if they can't get a parent to provide one?
That I am not sure of, but I can look into it and we can. Nikki, do you have the answer there?
Well, I was gonna say, in my experience, when the school is trying to develop a seizure action plan, and that parent or a guardian just is not able to be a part of that process, for whatever reason, the school will and may go ahead and just develop one on their own to their best knowledge or practice of what they've seen in a school, as far as the seizure presence and the seizure history. Again, we don't encourage that because I'm missing a lot of that key information that the families have. But again, the school will kind of work with what they have to work with and make their best decisions off of that.
Great. Regarding the listening session, Sarah, is that live or virtual, and do people have to sign up for that? And how would they go about doing that?
Yep, that will be virtual, and we will have emails going out fairly shortly with a sign up link. So it will be a sign up link and people will attend over Zoom.
Great, thank you. And then finally, a question about the again, once the individual, the nurse or the designated individual is trained, does the school have to let the parents know who is trained? Or is that for the parents that, would they have to find that out on their own?
So because the parents should be working with the schools to develop the seizure action plan, and that person who is trained in the nurse or the designated individual who is trained in seizure rescue medication administration is the primary requirement for the seizure action plan as defined in statute. The parent should be notified and they should be part of that process, and know that specific person is the person.
Okay, great. Well, I'm not seeing any more questions here right now, so I think we will, Nikki, I think you're going to have a little bit more time available to you, which is a good or bad thing, I'm not sure. But let's go ahead and move on to our next speaker, Nikki Baker.
Thank you, Debbie. And I do want to note, we did have a comment in the Q&A, and it's a great, this is what I love to see, parents sharing key tips with other parents that have worked so well. And so one parent commented that it would be okay for parents to include videos of their child's seizures if they have them to the school team, because typically, not always, but typically people will have a similar presentation with their seizures, and some can be very unique. And so it'd be great for them to actually see the seizure and kind of what to be aware of, because there are over 40 different types of seizures, and some are quite obvious or evident and others are not. And so it's really helpful for school personnel to be aware of what to look for or what to be on alert for. And so that's a great idea to share those key resources. And so I really appreciate you sharing that tip with us. And again, if any of you, if any other parents or guardians or school professionals have any other input here on that, I think again, peer-to-peer sharing is so effective. So I thank you for that.
Thank you for seeing that, Nikki. I missed
sure.
that one before I turned it over to you, so I appreciate that.
No
Now we'll
problem.
let Nikki go ahead and proceed with hers.
Yes. And so Sarah did a great job of just giving you an overview of what what the statute contains. My part here is to really break it down a bit more and really provide a clear idea of what the foundation can do to best support both you and schools going forward. One thing I do want to make clear though is this law does not put the onus on the parents or guardians to facilitate this. It is the school's responsibility to get their training in place and get their designated individual in place and make sure that a seizure action plan is in place. We just found it's really good for the families to be involved in that process. And so you do know what's going on and you feel safe sending your child to a school in regard to seizure safety. So we certainly don't want you to walk away and be like, oh my gosh, I have a huge list of things I have to do. I have to talk to the school, I have to do this. That the responsibility is on them. So please know that that's where that lies. So next slide, please. So Sarah did talk about in theory kind of what an action plan should be and what that process is. Again, it's up to the school to get that going. Clearly, your information as parents and guardians is going to be key to make sure that, in my opinion, the more information, the better. So when and if a seizure does take place, no one is going to be in true crisis mode as far as not knowing what to do or how to respond or who to tell or where to go. Because we work with many schools where, oh, we haven't seen a seizure yet, we're not concerned. And then it does take place, and then it was not handled in the most proactive way. So this plan is really aimed at ensuring that the parents know what is going to take place when and if a seizure happens, and the school is aware of as well of how they need to respond. So we do have a great seizure action plan, a template that we have it free and available on our website for anyone to download to either use as a guide or to use that template for the actual seizure action plan. And so we want to make sure that we're viewing our job is to help support parents and families as well as school personnel and give them as many resources we can to help support this process. The other key piece around the seizure action plan is that we are able to provide that one-to-one customized support around developing individual seizure action plans, or as I reference SAP here. So we do work with both parents and guardians and school personnel on, hey, I've got a child that has pretty complex seizures. Can you help us and just be a resource as we build this out? We are here to offer that support to anyone and anyone as they start to develop these action plans, because I really do kind of, I think of these as like that holy grail of like, this is what's in writing and agreed upon by both parties and what is people are going to go by and a reference. And so if we can be of any support to that process, we are here to offer that. We can also be a good a liaison or kind of helpful a tool, really as the epilepsy expert in the room, in really helping school personnel and parents and guardians work together to figure out what is most effective for that a student. We've learned that clearly your role as parents and guardians is to ensure that your child is safe and is being taken care of, and that they are getting the appropriate care that they need. And so the goal is to have everyone at the table really working toward that same a goal. And it does help sometimes to have kind of a third party in there just to help focus on the seizures and how to best respond to those. So that being said, as your school develops a new one that you've never had before, or your a child's seizures have now changed as they've aged, or medication now is changed, what's going on, there can be updates to this action plan whenever you or the school sees fit. And so don't feel like, oh gosh, we just did one 2 months ago and now we should wait until the next school year. You can call to have changes made at any time if there was a change in anything regarding your child's seizures. So keep that in mind as well. Next slide, please. I think you want to go back one. Yep, there you go. Thank you. So back to that, I had a question around what trainings are out there and for what audiences, and how do we access them. You'll notice that the training requirements written into that statute are very broad or very vague, and that was really intentional by both school nurses of Minnesota and EFMN as we work together to build this out, because our goal here is to make it as accessible for all people involved as we can. So that means what a type of educational materials are out there, how they're going to access them, and all those types of things that we don't want to make it harder or more challenging for people to access these things. We want to make sure it's simple for all people involved. So to speak to the school nurse first. So there are two very specific virtual or on-demand trainings that school nurses can access. They do get CEUs free with these trainings, and they're very focused on school nurses. And so it's different content, different level of information. The one from our national org, EFA, runs about 2 hours and 45 minutes, pretty in depth. The one that we offer through the Minnesota affiliate is 75 minutes. And so they each cover very similar things. It's just a level of depthness in each of those. And so those are available free of charge. The other pieces around a school nurse a training is we have both printed and digital self-study materials as well, based on how much they already know. We worked with some school nurses that have seen, unfortunately, so many seizures throughout their career. They may need a different level of information than, say, a school nurse who just has not seen or worked with a student with seizures. So we really want to provide an array of information and ways to access that. The other piece is we can also provide in-person live trainings to school nurses, or do live virtual trainings as well. You know, unfortunately, or I should say, one of the fortunate things through COVID is we are offering a lot more live virtual trainings, which means more people are gaining that information that we were never able to serve before because it was in person all the time, and things like that. And so it's really reset our philosophy and how we are able to serve all of Minnesota in various ways. Then on to the administration of rescue medications or emergency medications. So currently there are 4 different ways to administer that are FDA approved for rescue meds. The oldest kind of, and what's been a default has been a diastat, which is a rectal gel. So even though it is effective to administer a medication into the body that way, clearly it is not ideal for that student. And so we're really glad to see that there's now more options for people to choose from. And so in addition to that rectal gel, there is a liquid form of the buccal med, and so that's an oral med, and so it's typically measured out, put in the gums, and then rubbed in, and that gets absorbed that way. This works great for some people, but for others, depending on the seizure type, especially if you have the tonic-clonic or the grand mals, when you do have that excess saliva going forward, it is hard to gauge like how much medication is actually being absorbed. And so really important for you and the physician to make sure that you're picking the right rescue med for your child and what'll work best. The last 2 are both nasal. So the newest one, which was just FDA approved within the last 2 years, is pretty slick. It's a pre-dose. You just have to take the cap off and you insert it into one nostril, rub it in a little bit, and do a second insert on the other side, do another spray, rub it in. Pretty simple. So that is a newer one that we are seeing prescribed more and more. The prior nasal admin there was a nasal spray, but you had to dose it, and it came with an atomizer where you did have to put it on, and it was a lot of clunky work there to make that happen. And so the pre-dose is a much easier version of that. So point in all of that is, once you do have emergency med prescribed, we do have 4 videos for each of those administration types that schools can reference. And I will say that all school nurses in September did get some communication from us naming all of these resources. So we are really trying to be proactive and provide them with these resources. And then on to school personnel education and training. So, I need you to go back one slide, please. Thank you. So these ones are very similar to the school nurse trainings, except they are really aimed at school personnel. So it's talking about how to respond to seizures in a school setting. So EFA has one for 75 minutes. We offer one for 60 minutes. They can be watched at anyone's schedule there. We can also go in person, live, virtually, and all those access points as well to ensure that people have as much access to things as they need. The other piece of this is with those self-study materials. Sarah has developed a great overview of the different aspects of epilepsy and seizures, where it's kind of a one-stop shop to go through everything. So that's available. We do also have very individualized pieces. So say you have a child where they're epilepsy may cause some learning or cognitive challenges, there's information we can give on that specifically as well. So please feel free to reach out on anything sort of a nuance to your a child where you want more specific information. Next slide, please. And so now getting to the student supports, we talk a lot about the parents, the caregivers, school personnel, and all that, which is key to, again, make sure that students' safety is a priority, but we do not want to forget about the students and how they experience seizures in a school a setting, and what we can do really to help support them. So in school setting, we do offer what we refer to as classroom kits, and so it's this little kit that they get to bring to their classroom, and with the help of their teacher can almost help train their fellow classmates, and they get some free giveaways. They do an activity. We do have them dependent on a grade to make sure it's age appropriate. And so if that's anything that your child ever wants to be a part of, we do have that as a resource. We do offer virtual in-person classroom learning sessions as well. Very, very much, again, age appropriate. Some students do want to be a part of that, and others are just not ready for that yet, and that's okay. We just talk about in general seizures and epilepsy, and I really respect where each student is at with whether or not they want to be involved with that. The epilepsy and awareness tools, we've seen some great initiatives that students have wanted to do within their schools around, hey, I want to have a seizure awareness day at my school. So we can really help them plan those out and give them fun resources to make that happen. And so that very much is individualized in what a student wants to do. We've heard various we've done plays about it. They've done awareness kind of campaigns within the school. So that is an option as well. And then, of course, that IEP and 504 plan guidance. Epilepsy is covered under each of those. And so that's not to say that every child with epilepsy needs one, but we are here to offer, again, that strong epilepsy lens to help guide and build those out. And then outside of that school setting, Debbie did a great job of just kind of an overview of the programs I listed here. And I really must say, being a part of these programs for so long, kids and youth meeting other youth that have seizures, it can be really powerful. I remember last year at the Shining Star event, it was a newly diagnosed 8-year-old, and they lived in a small town, and he walked in and he goes, wait a minute, so if you're telling me that all these kids in this room have seizures like me? And his mom was like, yep. And he was just blown away because he didn't know anyone else at that point. And so we really want to make sure that we are providing opportunities for kids to meet other kids, try new things, I feel less isolated, and have some fun too. So we really encourage you to kind of check out if your a child may be a benefit from any of these going forward. Next slide, please. And lastly, I just wanted to really dig in a little bit to this on what information services it is. It sounds like a very formal service that we are providing. It's actually quite the opposite, because what happens is when a parent or a guardian or school personnel call us and say, I need some help with this. I have a child, or I'm working with a child that has, these are kind of what makes it a little bit more complex, or they're a newly a nurse, we can offer that one-to-one customized support that you as parents, I don't need to navigate 8 different systems to try to get one answer for everything. We can help you do that. So we want to take kind of that burden off both parties of, we are here to tackle epilepsy and we can help you figure out how the needs are and how to best meet those needs. And so you again can access this phone, email, virtual, live. Again, we want to be accessible to all. And so these may really mean individual meetings, tools, and resources that we think may be most beneficial here. Or we work hard to build up a pretty robust community network. And so we know if we can't give you the most effective answer, we know who can. And so we will connect you with the right orgs to help you do that. And next slide, please. All right.
Okay, so let's look at some of the questions that have come in. As a nurse, I'm used to dealing with seizures and remain calm through them. Does anyone have any tips on how to help staff not completely panic when it happens? They have all gone through seizure training and have watched videos of a seizure, but for some reason, I have some staff that lose it and don't know how to help them anymore. I don't know how to help them any more than educating and talking them through it. I've gone through the action plans with them before school starts and talked to them individually.
That is such a great question. And unfortunately, we see that in many different settings. I just had this conversation with our camp partners. So you are not alone in this. I think that fear is a very powerful provocation for people. So a fear of the unknown, fear of what may happen, and all of that. So that really drives what I tend to keep telling people over and over again, is that you set the tone for everybody else. Certainly if you're around children, if they see an adult panicking, that is going to set it off down that a chain there. What I would say is when schools have talked to us about that, they have pulled us in as a third party to talk specifically with the school personnel. And what I've said is, instead of going through a formal presentation and just giving them all this information, I have I started off by saying, how many here have seen a seizure? And then they kind of like, okay, I think I have. And then I do ask them, what did you feel when you saw that? So then they share what their core kind of feeling was during that time, and what are they fearful of? Are they fearful that they're going to mishandle it? Are they fearful that they're going to get in trouble? Are they fearful that the child is not going to come out of that seizure? Because what I found is most of the things that people are fearful of are typically not going to happen. And so I feel like getting at the root of why they're panicking has been helpful. And so if that's any way that you can facilitate that as a school, a nurse, or we again as like a neutral third party can do that as well, I think that'll help really provoke the people to say, what are they panicking about? Because it's normally not what we may think it is. I hope that's helpful, but.
That's great, Nikki. Thank you. I do want to encourage people to continue to ask questions. We do have a few more minutes here. This next one, actually, Nikki, you already addressed, but this is more of a thank you. Someone wanted to make sure we brought up those classroom kits. She said that this person used one when they were talking to their son's third grade class a week ago. So happy to hear that people are using those kits and are finding them as useful as we intend them to be.
Yeah, and I do think, depending on if a student isn't involved or not, them being a part of or kind of like owning that really doesn't empower them if they are ready to share that, which I know not everyone is. But them taking a part of that, I think really gives, what I've seen with students is gives them a confidence in like, yep, okay, like I have this and here's what it is and here's what it's about. And most of the time where I've seen in classrooms is once students know what a seizure is and isn't, they're like, okay, I'm good. I it's not a big deal anymore. And so again, it's that, like, when people don't know, they assume things. And so we are just really trying to dispel those misperceptions there.
I don't have any more open questions right now, but I want to give people a few minutes here still to write some in. So I thought maybe I would ask them a couple things that I sometimes get questions from parents or from schools even. And one of them is regarding the seizure action plan and what level of involvement the child's doctor should have, and does that doctor have to sign off on that?
Great question. Legally, the physician does not have to be involved with it. I typically, where I've seen a physician get involved is if the school personnel and a parent can't come to kind of an agreement on it. The parent can, or a school can get the physician involved to really make it clear what medically needs to happen. But my experience is that it's kind of like not worst case scenario, but like the thing you go to lastly, if you cannot get agreed upon a plan, certainly for the students with the who are more medically complex, it may be good to loop them in early, just to make sure that, again, if they're on 12 different medications that are indicated for 12 different things, that would be a flag of like, okay, we need to make sure that what we're doing is good for all of these parts, not just the seizures and the epilepsy. So that would be a good example of when to pull in a physician. But I don't see it that I typically need it if the school and parent can work together on that.
Okay, great. We did have someone provide another tip. For some, it's hard to see what the child's facial expression is, as that sticks in the brain for the longest, what you see. So as a parent, I tell others, first and foremost, take a deep breath, then focus on keeping them safe. Third, pick a spot on the body to look at versus their face. Lastly, hug them when it's over if they will accept one. It's harder for them than it is you.
That is a great point, because I don't have a child with epilepsy, but I have seen hundreds of seizures, and I can only imagine when it's your own child, what you feel and kind of what you go through. And that parent was right. Like, you want to fix everything kind of and that seizure immediately. When in turn, the most cases that a seizure just needs to run its course. Clearly, if it's prolonged and there's clustering, that's a different piece. But I mean, your job is to keep them safe during that seizure. And so, oftentimes, I know I have felt kind of helpless, like I'm not doing enough. I'm turning them on their side, or I'm reassuring them. One key point that she did mention is once the seizure is kind of tapering off, even if they're conscious is altered, reassuring them is vital. And so making sure that you're telling them you're safe, you're okay, you had a seizure, I'm here, you know, just again, reassuring them, because coming out of that seizure can be pretty scary as well. And so our job is to make sure, again, we are fully supporting the whole process of that seizure. So when it is happening and as they're coming out of that.
Absolutely. Great tips. Here's another one. If my child needs rescue medication administered, can someone else besides the school nurse administer the rescue med?
Absolutely. So one of the great things about these epilepsy rescue meds is anyone can administer it. What is under the law is that there does have to be at least one person who is almost like assigned to do that. But say that one person is out sick that a day, anyone else can administer that. And so I work with some schools where they have 5 people trained just in case they're closer or that a person is out that day or what have you. And the videos that I train you are really in a depth as far as step by step by step. And so anyone can administer that medication.
Thank you. I think that's an important distinction to make between what the law requires and what is actually possible in practice.
Yeah.
That's great. I think maybe we can fit in one more. How can someone, you talked about the different ways of training and in person, and that we have the on-demand trainings available through our website, but how would someone go about if they wanted to schedule an in-person training?
Well, gosh, out of all the questions, I feel like that may have stumped me. I do feel like there is a place on our website where you can request a training, and then there's options on there of like in person, virtual, those things. And so then whatever region you are from, that'll send it to the appropriate regional outreach a manager that serves your area to I'll follow up with you to make that happen. And I will say from mid-August to today, we have trained over 8,500 school personnel. And so as much as I hate to admit, like a law had to be passed to get this going, I am glad it is here, because people are accessing these trainings and learning more about seizures.
Absolutely. And if worse comes to worse and you can't find it on our website, how you can always call EFMN, call information services. We can put you in touch with the regional managers for your area.
Absolutely.
And I just checked actually, so there is a link on our Seizure Smart Schools page that will send you directly to a form where you can request a training.
I knew I saw it
Fantastic.
somewhere. Thank you, Sarah.
Yes.
Yeah.
Thank you, Sarah. Appreciate that. All right. Well, I want to thank again Sarah and Nikki for sharing their expertise tonight. Wait, I think I might see one more. Oh, yes. Someone just verified that, yes, that they were able to find that on the website. So that's good. No, I want to thank Sarah and Nikki both for being here tonight. Excellent information. Appreciate hearing your expertise. You know, we have wonderful people working for EFMN, and you two are proof of it. So thank you for being here. Before we wrap up tonight, I do want to just remind everyone about who EFMN is and what we do. Well, we lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies to stop seizures, find cures, and save lives. And I do want to put, you've heard about information services at least 3 or 4 times tonight, but I do want to put in one final plug for it, because we were talking about information services in the context of the Seizure Smart Schools legislation and helping people with the schools. But I also want you to know that that free one-on-one support and those customized tools and resources that Nikki talked about are available on a variety of epilepsy related topics. So if you have a question on anything related to epilepsy, I encourage you to reach out. Don't hesitate to ask. There's a form available on our website that you can fill out. You can also call us. The form is available at this link, efmn.org/information-services. So I do encourage you to take full advantage of that. And we also have a lot of written materials that can be accessed in that way. So please reach out. Our next Wellness Wednesday webinar will be on Wednesday, of course, October 26th from 6:30 to 7:45 p.m. And it's a topic that is kind of tough to talk about sometimes, but very important. And that is sudden unexpected death in epilepsy, also known as SUDEP. Our speakers that evening will be Allison Kukla and Kate Brocker from the National Epilepsy Foundation, EFA. And to register, you can go to epilepsyfoundationmn.org/events. I want to thank you again for attending. Oh, Nikki, did you have
Yep,
something?
there was just one other question I did want
Okay.
I to just answer here. And I just looked up this number for someone else. So I do happen to have it, but someone asked, do we know the number of children in Minnesota that have epilepsy? And the CDC does have their most current study, 2016, which I know is not, but for a research that's pretty accurate. They are ranging about 7,400 youth, 0 to 17 years of age, do have active epilepsy right now. They do also plug in a confidence interval, which gives a range of up to 9,000. So if you kind of keep that range in there, that is how many.
All right, great. I'm glad you snuck that last answer in there, Nikki. Thank you. Again, thank you all for being here tonight. Thank you to Nikki and Sarah, and I hope everyone has a great evening.